Uh, Ladies and gentlemen, dear participants, dear guests, all of you who are following us online, welcome and good day. This is a virtual panel organized by Unfpa, United Nations, here in Serbia, Belgrade, and the reason we're here is the World Population Day. Crisis caused by COVID-19 will change the way we live our lives, the way we think, the way we plan our future. Unfortunately, a great many people have passed away during this crisis, and many families have lost some of their members. So first, we would like to tell them our most sincere condolences. Families, communities, states, their economies are facing a test right now. Today, we will talk about the most vulnerable ones, about the goals that we've set before. Are they going to change? Are they going to transform? How will we proceed with the changes that are imposed on us? How did COVID impact the position of women and girls and vulnerable groups, migrations, the elderly? Communities, they need special attention. What did we learn and how do we go on? With our dear participants today, we're going to discuss about the lessons we learned, about what we observed and noticed in the previous months, how we can figure out the future that awaits us, especially bearing in mind that the health situation in our country has worsened. This is as the experts say, the second peak of the first wave of coronavirus. We also want to hear your opinion, so we invite you to join us on our Facebook page, UNFPA in Belgrade, Serbia. Share your comments. Feel free to ask questions. Our participants will be happy to answer during this video virtual panel. The whole video will be available on our YouTube in English, UNFPA Serbia. My name is Branko Veselinovic. I come from the national broadcaster, RTS, so I would like to wish you welcome. Professor Slavica Đukanović, Minister without portfolio, who's in charge for demography and population policy in Serbia, Mr. John Kennedy Mossotti, Director of UNFPA for Serbia, Francine Pica, President Representative of UNDP in Serbia, Jelena Hrnjak, Program Manager of the NGO Atina, and Dr. Dragan Stanojević from the Faculty of Philosophy, Department for Sociology, Belgrade. Good day, and thank you for accepting our invitation to participate in this panel in these difficult circumstances. We know that sometimes it's not really easy to organize a virtual panel, but we will do our best to make it work. Professor Đukanović, you are here to represent the government of the Republic of Serbia. So at the very beginning, maybe you can share a few words about who is affected the most by this crisis caused by COVID-19 in our country. I cannot hear the minister. Professor, we are experiencing technical difficulties. If you can please turn on your microphone, it seems to be muted. Do you hear me now? Yes, everything is fine. Good day. It is my pleasure to participate in this virtual conference, in this panel. This is a good opportunity to talk about our population in these specific circumstances, such as the pandemic of COVID-19. It shows that we have to deal with population as a whole all the time, and not only today on July 11th, the World Population Day. First, I would like to say that COVID-19 and this pandemic is one of the biggest crises in the modern ages. And an American professor I respect very much said that it is very important that in this period of crisis, this harm and damage caused by the crisis is reduced and mitigated if possible, and that all the lessons we learn become something beneficial for the future situations so that we can know what to do next time. So we hope that we will use this as an opportunity, and as a member of the Crisis Committee, allow me to share a few words about how Serbia organized itself during the pandemic. On March 15th, we created two crisis committees. One dealt with health issues directly related to COVID-19, and the aim was to avoid the most harmful consequences and the number of deaths, so that our healthcare system is organized and that it provides the necessary help to the citizens. The second crisis committee was there to prevent the harmful consequences of COVID on economy and life in Serbia. The first crisis committee is headed by Ana Brnabić, the Prime Minister. The second is headed by the President, Aleksandar Vučić. As a member of the crisis committee, allow me to briefly present our ideas and problems in our organization. First, even though this pandemic came suddenly, our experts and our healthcare system at first, starting from March 15th, had to fully adapt the whole system to the new needs to prevent mass spreading of the illness and a high death rate. So in that sense, the full capacity of our healthcare system was transformed into COVID hospitals and COVID clinics. Then we face the fact that we lack medical doctors who are specialized in infectious diseases and epidemics. So we had to quickly educate other doctors so that they're able to diagnose the disease and treat it properly. And in this period, we also tried to detect the biggest problems, such as what are the most vulnerable groups of population. It's mostly the elderly because they have other healthcare issues, which is why we use this measure of isolation of all persons older than 65, so they were quite protected. However, children, they can spread the disease, and they had to still continue with their education. So we closed the schools, and we had televised curricula for primary schools and high schools, where the middle generation, that was the active one, suffered the biggest burden because they were taking care both of the children and the elderly. And allow me to say that in the healthcare and the social welfare system in Serbia, the majority of workers are women, meaning that women were the ones who were the most exposed to infection and all kinds of burden. You asked us about some specific demographic parameters, so I'm going to share just a few. In 2019, we have monitored two basic parameters. I'm not going to give you the figures, but those are the birth rate and the death rate parameters. But we're one out of 10 countries in 2019 that had more newborn babies in comparison to 2018, and we reduced our mortality rate in all the former Yugoslav countries, Hungary, Romania, Bulgaria, and Albania. The number of newborn babies has dropped. However, in these first 5 months, the situation has completely changed. So we have 793 babies born less than in the first 5 months on 2019. And what is interesting for the whole region, not only for us, is that the death rate has dropped by 1,360 persons. So 1,360 persons less died than last year. And this parameter is typical for all the countries in the region. There are 3 countries in the region, Hungary, Bulgaria, and Montenegro, that also have the trend of growing birth rate in the first 5 months of this year, despite the epidemic. So if I can wrap up my first intervention about the lesson we learned from this, the lesson we learned is that we need more epidemiologists, virusologists, infectologists in Serbia and in the region. more medical doctor. The same way that we have firefighters and we still want to avoid fires. But even though we don't want to have fires, we have to plan to have enough firefighters. If it happens, we have to plan to have enough doctors for the possible outbreaks. And also we have to prepare the venues, the facilities, the equipment for this, and not to purchase urgently when the outbreak already happens. Now we are in the second peak of the first wave for Belgrade, which is the biggest hotspot. We have special measures now. You know that it is prohibited to have groups bigger than 10 people. Restaurants and stores must close at 9 o'clock in the evening, and all these measures also include physical distance, hygiene, wearing mask, and everything. Madam the Minister, are those the biggest challenges when it comes to demography in Serbia? Are there some other challenges that we didn't mention? When we talked on television, we discussed these issues. You are a doctor, and 30 years ago, when you started your career, people who had HIV back then were stigmatized by the community where they were living in. Did we learn something from that? Do you see similar things now? Yes, there is stigmatization. That is one of the reasons why people do not report their COVID on time, which is why the severe clinical picture is formed. We need more health literacy, so to say. We need better healthcare culture. We have to sensitize ourselves and our environment about these topics, that there is no shame in getting COVID, and whenever there's an infection or a crisis, we have to face it intelligently. We must not run away from it. We must not negate it or ignore it. Thank you very much, Mr. Mossotti. Last year in November, our delegation was among the delegations of more than 170 countries that committed to achieve 3 zeros, 3 transformative results. This was all happening in Nairobi. The idea was not to lose a single woman on childbirth, that every couple can access modern contraceptives, and to fully eradicate gender-based violence and harmful customs that hurt women and girls. Did this pandemic have an impact on these 3 zero obligations, on this 3 zero commitment?
Dobro jutro, drago mi je što tu.
Good morning, I'm happy to be here with you.
Thank you very much to be here with you. And I'm really grateful that you've asked a very pertinent question. The Nairobi summit was really a transformational summit. And I was indeed privileged to have served as the Deputy Global Coordinator based in Nairobi for that summit. Now, the Nairobi summit had put a very ambitious agenda before all of us. And unfortunately, what's happening is that COVID, the pandemic, is really presenting us with challenges on achieving those goals. The challenges of achieving zero maternal deaths, or zero unmet need for family planning, and zero gender-based violence, unfortunately, has been going on for a long time. And you know, we've been running out of excuses. We need to run out of excuses and really face some of these conditions head on. Admittedly, Corona has been devastating. I must say that. But again, sometimes let us not use Corona as another excuse. We have to keep our eye on the ball, and we have to stop the excuses, because we have to win. But what we do know from pandemics around the world is that indeed they affect women and men differently. So the largest share, for example, the largest share of frontline workers, health workers, including in Serbia, is almost 70% women. And they are disproportionately exposed to the coronavirus. Access to sexual and reproductive health services is impaired. Emergency response during COVID outbreak also meant that resources, some of them are diverted to other areas, and what means that the responses, and for those who actually need the services, do not get them. And I'm very grateful to the Honorable Minister because she led, not only did she lead the delegation to Nairobi, Serbia, where they made very bold commitments, but also because of the support and some of the words that she's used this morning, especially addressing some of the vulnerable groups that are affected. And I must say, some of the things that have actually happened to women is that, and to try to contextualize it, first, around 47 million around the world are going to lose access to contraception, and which would mean that almost 7 million pregnancies are going to be unintended, and that is something that has to be taken into consideration. The other factor is that intimate violence is also going up. Domestic violence is also spreading. Tensions, there are tensions within families and within partners, and this is something that we have to be able to be very careful about. So unfortunately, this is what happened, because women and men are actually locked in the same house. What's happened is that officially the reports to the police in Serbia, we know that there are few. There were not that many. But we do know from the calls that were made to the SOS lines, especially those organizations that are handling these issues, they recorded a much higher level of distress, especially amongst women during that same period. What that means, therefore, is that there are lots of women who are locked in, so to say, with their abusive partners in the same house. And unfortunately, they cannot complain to the police because of the consequences. So while all these things are going on, the economy is shattering, the unemployment rate is skyrocketing, the financial stresses are going up. And these are conditions actually that make some of these challenges to continue to go even higher. So the consequences at homes, consequences in the family settings, it is incumbent upon us then to take certain specific actions to be able to make sure that we reduce and address these risks. We support and protect the victims and demonstrate leadership in the way that we need to be able to handle this. Now, one of the other zero is making sure that we also end child marriages, and potentially, because we need to be able to stop, there are potentially about 13 million children who are going to get married in 2020 to 2030. And unfortunately, when under stress, what happens, because especially the burden and everything else, some of the families, especially in other jurisdictions, not specifically in Serbia, we get that there's a, increase in these marriages. And lastly, of course, the economic crisis exacerbates pre-existing inequalities. So especially because of this pandemic, we realize that employment opportunities become less, and especially for women, we see less and less women, fewer and fewer women participate in formal employment, even political participation, representation, health outcomes, and education achievements actually become lower. So what has happened, and in Serbia, what we did with UN Women, we actually did a gender rapid assessment. It's going on, and the results are going to come out in a few days. And that would be able to provide us an insight of exactly what is happening with figures on the women in Serbia. But thank you very much.
Mr. Mossotti, if we compare the previous pandemics that the world was facing, what is different today? Is it the scope? Do we have some lessons learned that will not surprise us tomorrow?
One of the most curious and unique features of this pandemic is that really, other than really war, but other pandemics have not been as devastating as this, because it has had, unfortunately, it is unprecedented, because where we did shut down economies, we did restrict movements, it had an effect on certain freedoms and how you actually engage, not just women, but also young people, older persons, men in general. It was different. It has never been done before. So there is no precedent to look actually back to see how to be able to respond to this. But one of the most important things that we must say is that there have been valuable lessons every single day as we move on. We've seen exactly what needs to be done. Things like taking care of yourself, making sure that you care about your neighbor, making sure that there are better ways of working so that they do not provide more stress to women and families. We've seen all these things, and these are important, and lessons learned can actually be applied in future in terms of how we'll be able to respond when in a similar situations are bound. Thank you.
Pokazuje li svet dovoljno
can world show enough solidarity? You talked about relationship within the family, with neighbors. Have we passed this exam?
You see, unfortunately, the situation that we are in is that there's only certain things that we could be able to do. Because of social distancing or physical distancing, as we'd like to say it, it's not really social, is that physically we are trained, we are ingrained to be able to get in touch with people and to talk to them. Unfortunately, now we have to use medium like the one we are using right now, or phones. We cannot get in touch with people. But again, I think what has happened is that it has actually brought certain people closer, because not only do we have to go distances to be able to make connections, we can actually use other media to be able to get in touch with people. Yes, certain relationships have strengthened, but I must say, for certain other categories, and I hope that we speak about this, especially older persons, it has not been very good. They've really suffered from loneliness, from all kinds of anguish, and we probably need to talk about those too as well.
Hvala gospodine Mosoti. Gospođo
Thank you, Mrs. Pickup. You, as the resident coordinator of UNDP in Serbia, what do you know about how the pandemic affected the population and international migrations? Hvala.
For organizing this event. In UNDP, we've been working very closely with Unfpa and the government to better understand the issue of depopulation, because it's such a major challenge affecting this country, and we see it affects so many different aspects of life. And so we started exploring this issue, and we came to the conclusion that the solution doesn't really lie in encouraging families to have more children, or even in trying to stop people from leaving the country. The solution really lies in improving the quality of life for people in Serbia, and really looking at depopulation as an integrated development issue. So when COVID hit, of course, this had a big impact on our work, but we saw a lot of opportunities come up out of this change that happened because of COVID. So, for example, one thing is we'd noticed in the past that we needed to do more to connect with the diaspora. Serbia has a huge diaspora, and so we need to invest in that diaspora rather than just see them as, irrelevant to Serbia. Now, when the crisis hit, we found a lot of that diaspora wanted to engage. They wanted to provide support. So, for example, there were medical professionals scattered around the world from Serbia who really wanted to help, and they reached out to us. They reached out to our counterparts, our partners in an organization called Returning Point, and said, how can we help? How can we volunteer to support in this crisis? And we very quickly were able to put together a list of 350 medical professionals who were stuck at home in Europe or wherever, who wanted to provide support through telemedicine, consulting, or whatever. And this is a small indicator, to my mind, that we really can tap into that capacity that the Serbian diaspora has. Another thing that we saw in the news is that there were about 400,000 Serbian migrants who were living outside who came back to Serbia before the borders closed, when we had that first peak. And these 400,000 migrants, I mean, these people are potentially contributors and supporters to Serbia. They may want to stay. So what would it take to retain those people, for them to decide to stay in Serbia rather than go back to Europe? And so we want to work to really understand who these people are, what their interests and needs are, and what their potential is for the Serbian economy. Because at the end of the day, I think, when it comes to a crisis like COVID, of course, the physical assets like the hospitals and the medical equipment, the ventilators and so on, these are really important. But the other thing that's really important for coping with and being resilient in a crisis is the social capital, the connections and the cohesion within communities. and how people help each other, the solidarity that you were talking about. That's really important for how people survive. And then the human capital that the minister was talking about, the skills that we're nurturing within the country. So these social and human capacities and assets are as important as the physical assets for the country's resilience to be able to cope with this terrible crisis.
Hvala vam najlepše.
Thank you very much for this answer, and we'll now discuss with Mrs. Jelena Hrnek. She's program director of Athena NGO. One of the questions that imposes itself is how this pandemic has affected women and girls, primarily in the increase of the risk for this population group. No, I can't hear the speaker, sorry. Here I am. Thank you for the question. We can see that women displayed great resilience and courage to fight and to survive. When we look at women like nurses, everyone mentions doctors and they are really the stars, while the nurses are somehow in the background and their contribution is immeasurable. In spite of everything, they managed to resist all the challenges of COVID. When we look at shop assistants, pharmacy assistants, where predominantly women work, it is presupposed that they will arrive at work every day, that they will be there every day. All these women are our power. We saw a great will, and we can say that for women victims of violence, because it increased their permanent emergency situation. Many of these women were socially isolated even before Corona, and they know very well what this sensation means. Unfortunately, also without the COVID pandemic. So they were deprived of the freedom of movement and other freedoms before. You know very well that violence has not subsided, that there are many women that suffer violence, that even wars stop, but violence against women does not subside. If you allow, what are the dimensions of this violence? Even the Secretary General, Antonio Guterres, said that there is a terrifying global increase in this area. How much do we know about this data for Serbia? If we were to look at the official statistics, the number has reduced. However, we from the NGO, Athena and the other CSOs, we believe that this is not the only measuring unit for analyzing this issue. There are many reasons for this. Firstly, our experience is that only when they feel sure enough to report the perpetrator, the women will report him. Also, there was a psychological delayed reaction. They will report violence only after the emergency has been lifted. According to numbers, we can see that it is true. So why do they hesitate? For many reasons, because they were closed with their violators at home. They could not access the telephone to ask for help. And when they did so, there was no one to answer that. It was not easy to access help. The assistance providers and the social protection system was in an unenviable position because there were many problems, and we learned this in the COVID situation, that all the guaranteed rights, we had to fight for them. For example, the admittance of women into shelters was aggravated. They had to bring the certificates that they are COVID negative. and they could not reach the abortion services, although this right was guaranteed. There were many, many challenges faced also by hospitals, so it was not feasible. They had to go refer to private practice, and it would, for those who couldn't afford it, it was inaccessible. Also, pedophile content demand increased. It was drastic. The predators in the online world increased due to the decreased monitoring by parents and an increased presence of children on the internet due to isolation. Use of pornographic material on the internet increased by 30 to 40% during this time. So it is very important to have these parameters that we can look at along with the life stories of women who suffer violence in the field. What the CSOs believe as a missed chance by our state is that they did not set up the third staff which would care for those who are not cared for in the society, who are at the margins of the society, not with us but beside us. Those who lack more social protection. And in fact, when we talk about the response to COVID, of course, our first response was health response, but the social dimension was lacking, the social dialogue was lacking. Visits to Roma settlements, our access, direct access to these people. We learned during COVID that working online is very good, but nothing can replace direct contact, establishing the relationship of trust. There is a great gap. No, we don't have good links in Serbia. Not everyone has access to internet in Serbia. So there are many reasons why women and girls get into more and more trouble. Thank you very much, Mrs. Hrnjak. When we talk about the challenges of parenting and working from home, in April, the Unfpa started the action data in quarantine to that is that in quarantine to encourage men to get more involved in what was going on with their children, in organizing their time, helping women and mothers. Mr. Stanojevic, has COVID-19 affected or changed this balance of equality in families?
I would like to thank Unfpa for inviting me to participate in this panel. I would like to greet the other participants as well as our viewers in social networks, and thank you for your question. I think that it's less actually probable, because the survey has shown that crisis and continued stress have multiple negative effects on family lives. A large number of families manages to respond to that by establishing some sort of balance that usually mimics the previous situation by reproducing the family relationships they had before, whereas another large number of families responds by having the family relationships worsen. There's also a small number of families that have enough internal and external resources to properly respond to the crisis, to show resilience, and to establish better relationships. But this is why your campaign is important, and this is a good moment to talk about mental health in public, because psychological support must be more accessible in these circumstances. When we take a look at the wider survey results, they show us that in these situations when partners have to rely on each other, their intimacy can grow and they can be happier with their relationship, which can result in more even distribution of chores, parenthood obligations, and other obligations that they have. And for some couples, this is actually a second chance, an opportunity to reinforce their relationship. However, bearing in mind that this is a continuous crisis, as We've seen it's not 2 months, 3 months, it is something that is here to stay for a while, and it will mark a longer period of our lives. So in these circumstances of stress related to health, related to finances, related to jobs and children's well-being, the family relationships and partnerships are under pressure. But when we talk about fathers, what are the biggest challenges that fathers in Serbia are facing at the moment? There are fathers, of course, but each father is different. They have different styles of parenthood, of fatherhood. They have different approaches. They have different reactions and responses to this. There's a certain number of fathers who have this non-traditional approach. So for these new fathers, the situation is almost a respite, a break from this busy work life and an opportunity to spend more time with their children, with their partners, wives, and families. However, for the majority of traditional fathers, this is a very challenging situation, being that work is their domain where their identity of family providers is based in. So with the new circumstances, their primary obligation is to provide for the family, but given that the crisis has a strong economic component, given that a number of people have lost their jobs, especially those from the lower classes of the society, those with temporary working contracts or no working contracts, these fathers are under pressure because as men, they're supposed to provide for the family, but they are not in the position to do that like they used to. And the consequence of this, not only to fathers but to families, is that this usually creates tension between partners. It creates tension within families. So even in families like this, there are two possible options to deal with the crisis. One is to overcome the crisis, but other surveys have shown, and we did some surveys during the crisis, is that it is quite probable that tension will grow within the families, that it will result in conflicts. My colleague Hrnjak already mentioned there are some indicators that domestic violence is on the rise. And NGOs dealing with these issues by providing support to survivors through online networks have already detected that this is an issue. Yes, we already have some specific figures. It is estimated that in 6 months of lockdown, there will be 31 million additional cases of sexual violence. It will result in postponing of the programs for against child marriages, and genital mutilation can result in millions of new cases of these phenomenon that are harmful for girls. But let us go back to what we committed to in Nairobi last year. Madam the Minister, you were the head of our delegation in Nairobi, and you know the commitments that our country accepted. What we have to do to stay on that path, on that journey, and meet our obligations towards women and girls. I was the head of delegation last year, and it was really a unique moment for me to be able to represent my state on a summit like that, when we reactivated the need for the conclusions of the Cairo Convention from 25 years earlier, meaning that population demography need more attention from the governments. So as participants, we had to pledge on behalf of our governments that we will keep working on protecting the rights and the status of women, girls, and families. This is what we did. I agree with Mr. John Kennedy that this must not be an excuse for what can done. COVID must not be an excuse. So in our towns and municipalities, we organized counseling centers funded by the government about improving and developing reproductive and sexual health, because previously, we have concluded the level of knowledge in these areas is pretty low in our country because our education system is not covering it, and our families are traditional, meaning that girls are not provided information within the families, and this must be done in an adequate manner. I think that the first results will show that we need to spread this network to include all towns and municipalities in Serbia. That will be our future task, but we did one part of that. Of course, advisory work means that we were covering also extramarital partnerships. We included issues such as active aging because we have an aging population, so we try to cover all the vulnerable groups. And what is particularly important is that local governments received grants for these activities, and they had the obligation to include the NGO sector, the local media, to raise the visibility of this topic in every way possible. As Ms. Hrnjak said a moment ago, that we missed the opportunity to create a third crisis committee that will be there to support the marginalized groups in our society. I think that in theory it is a great idea, but in practice it is not possible to have a separate committee that will do this. For instance, all persons older than 65 are at risk, but people living in remote rural areas or the Roma population older than 65 have even more severe risks. However, the governments, if they got this task to involve the NGO sector, to involve the local health institutions and the academia, they have to analyze their own situation, and they try to do their best to reach those individuals who are in most vulnerable positions. That was actually a measure that we suggested. Also, in June 16th, we introduced for all women this possibility to have artificial insemination covered by the Republic Fund for Healthcare Insurance. Now it is free for all women until the age of 43, no matter how many attempts. Then, when it comes to prevention of diseases in Serbia, it's pretty problematic. And when it comes to women, for instance, cervical cancer has a very high mortality rate because we're not working enough on prevention. We worked there. We supported the Center for Reproductive Health in Vojvodina, in Novi Sad. We have funded the vaccines for girls that will prevent cervical cancer. And one of the lessons learned is that certainly in emergency situations, in epidemics, domestic violence is on the rise due to all the reasons that we have heard. Also, addiction is becoming a problem because people are feeling trapped in the lockdown. So we have to monitor these vulnerable families. That should be a task, that should be a lesson learned. We have to expect in the future that domestic violence and other forms of violence against women and girls will be on the rise, that addiction will be spreading, including modern forms of addiction and substance addiction, and that the most vulnerable family members should be provided organized support. This all means that human resources are the most valuable ones that we have. Ms. Pickup mentioned this. We have to properly take care of our human resources, including the most vulnerable categories of population. Of course, we paid a lot of heed to international communication and cooperation within the high-level political forum in New York. We participated 3 days ago in an online meeting on science, technology, and technological development. The meeting itself was organized by the EU and the UN agencies dealing with science, technology, and innovations. And the impact of SDGs 4 and 9 but participants from Ghana, Ethiopia, Kenya, India, and Japan, and us, we have exchanged our experience within a pilot program that was organized there, and that was very important for us. It is certain that human resources are the biggest treasure we have. And if I can answer both of your questions by wrapping up my conclusions, to have a state institution that would deal with human resources, meaning population dynamics, meaning issues such as unemployment, aging, violence, those hot topics that we are often pushing under the carpet, that could be our task, that could be a good future step. We expect that this will be done until the possible second wave or another outbreak. Thank you very much, Madam the Minister. Mr. Mossotti, UNFPA, during the installation, supported these SOS hotlines and distributed the help kits to those that were in the most vulnerable positions, such as the elderly. What did we learn from that? What can we do to make sure that their voice is heard during this crisis, because they are the most affected by the crisis?
Hvala vam puno na ovom odličnom pitanju.
Thank you for this excellent question.
I must be really honest here. I think, unfortunately, we left older persons behind in this pandemic. They were truly devastated. And even when we knew the risks and we knew their vulnerabilities, we knew what we had to do, but we didn't do it. It is not rocket science. And as a result, we largely lost their trust. We did not do well. And I think one of the lessons that we've got to learn from how we engage with pandemics, we really have to be able to look at the groups that will be most hit. And in this particular case, older persons, and some of my colleagues here, panelists, have spoken about some of the challenges that older persons went through. We did not do well. Again, this is something that we need to review and work towards to make sure that we do well. Now, we know older persons are really the epitome of the knowledge. These are the people who built the cities, they built Serbia, they built our communities, they built our societies. But when it came to the hour of need, we did not stand with them. And this has got to change.
Ali nisu svi stariji ljudi na isti način.
Are they affected in the same way in this pandemic? There are groups within this population that are more affected than the others. Can we define them?
Sure, really they were devastated. And you have seen the news, I'm sure, you know, in the newspapers and TV, largely what happened in some of the cities, including in Serbia. I mean, like what happened in Niš. I mean, we knew that certain population groups, and we've spoken about women, we've spoken about older persons, they really were devastated. So we needed to have done something. We need to do something even moving forward. But you know what happened is that UNFPA, especially because of the restriction, we know they are older, and because of their advanced age, movement is also important because we need to keep that physicality going. So the movement was restricted for them, and we know that if they became or they remain inactive for some time, you know, certain physical things happen to their bodies. And not to forget their mental challenges. There are mental challenges as pertains to the organization of the older persons, how they engage and relate. So what happened in April, UNFPA with the Serbian Red Cross, we started running helplines for older persons. And we received hundreds of calls from older persons, hundreds of calls. And, you know, they didn't need much. And actually older persons don't need much. They needed a sympathetic ear. They needed somebody who would provide some advice to them, psychosocial support, and also just direct, sometimes just sitting around with them and helping them to deal with the daily issues that they have to deal with. But those ones were not as available. And, you know, because of the social distancing, because of the restrictions, which were important, unfortunately, we never formulated suitable cases that would be able to serve populations like older persons. But we are very grateful to the Commissioner for Protection of Equality in Serbia, because not only did they volunteer, like on a Fridays, they would serve the helplines and just listening to the problems. But also the commission was very clear in terms of appealing to loosen the penalties for older persons, paying special attention to them because some of them are suffering from dementia, and also those who are providing care for them, they advocated for them to be given some legal papers so that they could be able to move around past the curfew hour, which was very important. And then for medication, especially some of the army pensioners, they were given extended prescription for medications up to 6 months, which then at least allowed them to be able to have medication without moving around, but also gives them, their mind is settled because they actually do have that. So basically, the message that I want to say is that we did not do well by the older persons. We left them behind, but we cannot afford to lose them. And as I said, really, we have a duty to them and we owe them. And we have to be able to provide the platform for older persons to be able to speak up and to say what exactly it is that they think we should be able to do by them. They are wise. These are people who are wise, and we can use and tap that wisdom. Thank you very much.
Hvala, gospodine Mosoti. Nadamo se da to neće ostati.
Thank you. I hope this will not remain on paper. I hope this certain clear steps will be defined as to how to alleviate the problems of the older population to cope with this new normality. Mrs. Pickup, you talked about adapting to the new normalcy. So what does that imply? What can we do differently? How can we be ready? What do innovative technologies help us in this way? Hvala. Za mene postoje 3 lekcije koje treba da naučimo kako bismo bili spremni za reakciju i za ostvarivanje bolje budućnosti za nas.
Can you hear me well?
Da, čujemo vas.
Sorry. The first is around solidarity. We saw examples when the crisis first broke out of incredible solidarity, an outpouring of solidarity. We saw bad things happen too, like the increase in domestic violence, but we saw good things happen. So we saw posters on lampposts of people anonymously just saying, if you need help, contact me. And we saw the same on social media with people reaching out through Facebook. So we saw an outpouring of solidarity. We also saw small companies, posting fitness videos online or offering psychosocial support online to people who needed it for free. So we saw many, many examples of this, and we need to be able to channel those examples and make sure that the vulnerable groups like the elderly that John was talking about have access to this kind of support and solidarity. And I think technology plays a role in helping us accelerate and sustain that very positive solidarity. So just to give you an example, we supported the government to establish a platform called Budi Volunteer, which connected more than 7,000 volunteers who were wanting to provide support with those in need, particularly the elderly and others who were isolated and in need. And so it was a matchmaking, and technology helped do that. It connected those volunteers who wanted to help with those in need, including the elderly. And technology allowed us to reach out to a lot more people. So that's one lesson for me, that tech can really accelerate and sustain solidarity that exists in Serbia. A second lesson is we've talked a lot about the importance of tech to cope. People working from home, for example, or reaching out to friends and family using tech. We've got to make sure that we bridge this digital divide. Already someone mentioned that not everybody has access to technology. In fact, I think about 20% of Serbia's population aren't using technology right now. And so we've got to do what we can to make sure people not only have access to technology, but also can retrieve the information that they need and use the services that are available. So to give an example, when you're talking about vulnerable groups, one vulnerable group is the Roma. And so when education went online, we helped make sure that Roma would be able to access this online education. And similarly, when we talk about the elderly, I mean, the elderly need to be given and equipped with the kinds of digital skills so that they can make best use of government services that are available electronically, for example. So I think bridging that digital divide is really important, and it doesn't cost much. It's estimated globally that 1% of the money spent on stimulus packages, only 1% of that money is needed to make sure there is universal access to digital technology. And then the third thing I would say is that we really need to adapt our working environment and look at how COVID is affecting the future of work. So, for example, we've talked a lot about aging, and with Unfpa and the minister, we've talked about how Serbia is an aging society. The average age now is 43 years, but it's growing older all the time. And we have to stop seeing growing old as a cliff that you fall off, and when you retire, you stop being useful or productive or a contributor to society. Actually, older people have an enormous amount to give to society. And in this COVID crisis, I agree with John. We could have done much more to protect and value the elderly population. All around the world, we saw that. I think a society is as good as the way it treats its older population. And Serbia, with an aging population, has a huge opportunity to allow the older population to be more productive, to give them the digital skills so they can continue to contribute to the economy, and to create a care economy where Serbia becomes a good place to grow old, where nurses and medical professionals and social care workers have good jobs supporting the elderly. So there's a lot of opportunity there if we really see elderly people as an asset. Beyond that, I think, typically we would see small and medium-sized enterprises as really important to promoting growth during the recovery phase and being that engine for employing young people, attracting young people to stay and live in Serbia. And so with small and medium-sized enterprises, we saw that they were very good in many cases at adjusting to this new environment. So many of them moved online and started offering their services online. And in Serbia, I saw a huge opportunity with e-commerce. Not much of the things that you and I buy in shops can be delivered to your home, right? And so there's a huge opportunity there to branch into e-commerce and make SMEs more resilient and more future-proof so that they can work and operate and make money in these kinds of environments. So, making sure that they have the right kind of, access to finance and they have the digital skills to move into this new environment is really important.
Ja ću još jednom samo podsjetiti sve koji nas gledaju online da mogu da ostave svoje.
I will remind you that you can leave your comments on UNFPA Facebook page. If you look at the broader picture, Mrs. Pickup, you compared this crisis to the three waves, the upcoming waves that will affect the healthcare, economy. Why do climate changes are this third wave that we should be worried about?
Yeah, so I saw a cartoon recently, three waves hitting a beach. And the first wave was small, and that was the health crisis. And then the second wave was bigger, and that's the economic recession. And then the third wave is like a tsunami, a huge wave, which is climate change. And I think it was a good cartoon because it illustrates how these different crises are interconnected. And it makes the important point that we shouldn't address the short-term emergency without looking at the longer-term impact as well. And so this is really the key message for me, is that when we start responding to the emergency now and the health crisis that is still ongoing, let's have the future and building a better future in mind. And so when it comes to climate change, we're seeing, more extreme weather conditions, not just in other parts of the world, but in Europe and in Serbia as well. More droughts, more floods, more extreme and intense weather events. And we're also seeing temperatures rising. Now, with COVID, we also saw the link between the environment and health. So, for example, people, when in contexts where there is air pollution and high levels of air pollution, we saw that people were more susceptible to the risks of COVID in their lungs. And so people realize that there's a very intricate link between health and environment. And people also saw, when the economy slowed down, that it is possible to change environment. We saw air pollution go down dramatically. We saw carbon emissions go down. And we saw biodiversity was improved with new animals and plants coming back. So people saw that this radical change that we need to address climate change is possible. And so rather than going back to life as before, let's look at how we can invest in improving the climate and reducing climate change as we recover. So that means, for example, let's invest in renewable energy now. Let's cut the energy consumption that we do. I think young people have seen that this change is possible, and they're really going to be the engine to push this forward as we get out of this crisis.
I u tom smislu, gospođo.
In that sense, Ms. Pickup, what should come before? Changing the mindset and then changing the procedures, or changing the procedures will result in changes of mindset?
I think I'm a firm believer in the importance of changing mindsets, and that will create change. And the good thing that I've seen out of this terrible crisis, but I want to look at opportunities for change. And out of every crisis, you have an opportunity for change. People saw that radical change is possible. Already before the crisis, we saw people speaking up about air pollution. It matters to them. And the environment is starting to matter much more to people. When we do surveys on people's understanding about climate change, we see that it's the young people who care the most. And so this generational change is coming, and I think this issue will become more and more important to people. And I think that the COVID crisis has really amplified that message. So young people are organizing, they are starting to speak out, they do care about these issues. And I hope that as we build back after this crisis, we look at ways to build back that are much kinder to the environment.
Hvala vam najlepše, gospođo Hrnjak. Evo, čuli ste.
Thank you very much, Ms. Hrnjak. You heard our previous speaker. Looking at the future, what do you think what we can do? How to make things better and different? How can we support women and girls? How do we meet our obligations towards them? That's the most difficult question. Definitely. Maybe it's a question that I shouldn't answer because I'm here to represent one civil society organization, but you have a good insight into what's going on. Yes. This is why it's unbearable for me to hear that we know that there will be more women suffering violence, there will be more harmful customs for women, and there's no joint plan how to solve this. I think that this is all a question of accountability, of responsibility. I'm sorry that social dimension is something that is just theory, that this third committee is something that is seen as a good idea, unfeasible in practice. I think that in the long run it is going to cost us a lot. State institutions said that during the COVID crisis they managed to meet only 30% of survivors. The rest was met by civil society organizations. So I'm not seeing that we're building partnerships. I'm not seeing that we are supporting each other. I think that the issue of taking responsibility for how we're going to get out of the crisis is an issue. I see that as mankind we have caused this crisis by our relationship toward the environment, toward nature, toward each other. So what I can say is a message to all women and girls. You should rely on your own capacities to the best of your abilities. You should call civil society organizations for help. I know that among us there are brave men and women who are always willing to help, so you can rely on them. I think that the institutions themselves can't respond to this on their own. Without volunteers and the civil society sector, it is not possible to respond adequately. In Nairobi, there were representatives of the state and the civil sector too, and they have accepted the commitment of the relationship, of the partnership. So how to establish this partnership? Civil society organization exist for many years in Serbia. They're active in Serbia for a long time. It's not something new. It's not something that started yesterday. We have to reach a consensus. We have to see what is our priority. Who is our priority in our society? I hear from our panelists that there's a lot of issues with violence. If you have an old person who is isolated and ignored by the society, that is a form of violence. There is economic violence too. We expect, after we receive the last one-off social aid by the state, that the number of layoffs will increase. I traveled around Serbia in the past couple of weeks, and there's quite a lot of people working for minimum wages. And these things that will happen will increase this economic violence. So we have to reach a consensus about our priorities. If violence and combat against violence is not our priority, if that is just a periphery matter, we have to really reconsider our commitments in Nairobi and in our daily lives. We have to take responsibility. That is step number one. State must be responsible. Citizens must be responsible. The clear message is that victims are not responsible. We can't say all the time that victims must ask for help. That is the typical paradigm. The first question is, did you ask for help? Do you know that help is available? However, the real issue is whether there's enough outreach to provide them support, to encourage them, to let them know that help is available. Thank you very much. Mr. Stanojevic, we were discussing the behavior of fathers during the pandemic. You mentioned two groups of fathers, the traditional ones and those who are open to changes. Do you think that if we involved men more in the pandemic, if that can result in changing the mindset of the whole society about the true meaning of partnership and gender equality? I think that you have responded your question yourself. You gave your own answer. In any circumstances, including crisis, a high participation of men will definitely result in better gender equality, better distribution of parenthood obligations, of household chores, resulting in more harmonized and more modern families that are functioning in our broad society. However, when we talk about our family system, an important aspect of family as a system, as a mechanism, is having known rules and being able to foresee the environment in which the family works. So this predictability, this capacity to foresee how things will work is helping a lot during the crisis, because family is working through routines, and routine has changed in the crisis. So in order to keep this predictability, we need trust between all stakeholders, all actors. We have seen lately that there is no more trust. Trust is undermined because the policy of crisis management is not clear. There was a lot of contradictory messages. The virus is not dangerous, the virus is very dangerous, the virus is no longer dangerous, and now all of a sudden we are having again a very dangerous virus. So in a couple of months we had whiplash, we had U-turns in how families are functioning. First, families came together, they consolidated, they had more intense family relationship. within nuclear families, within households. On the other hand, extended families with grandparents, with aunts and uncles, cousins, there was a distance due to all the lockdown measures, which, despite the new technologies that allowed people to keep communicated, did have an impact. And in the long term, in the long run, especially with the elderly, people started to feeling isolated. They started feeling lonely, and they were suffering the consequences during these lockdown measures. So in that sense, I think that it is very important when we plan the measures along with their medical aspect, which is crucial, and their economic aspect, which is very important. We must bear in mind the social aspect of the crisis. And people as psychological sentient beings, and families and groups, they respond in a certain way during the crisis. Yes, we can foresee how it is by observing the previous crisis, and in that sense we can plan the future measures are part of crisis management policy. However, when we talk about families in crisis, parents and children, for instance, this relationship is also under a lot of pressure and stress, because even though there's more intense contacts, there's also more stress, both among the parents and among the children. And research has shown that in these conditions, warm authoritarian parenthood is dropping, and the more severe, harsher authoritarian approach to parenthood is on the rise, and that is a model that is very prevalent in our society. There are also different approaches to communication that we didn't have before, all the daily routines that I mentioned, such as school, learning, going out, hanging out with friends, having contact with other people, relationship toward health and hygiene. You have to deal with that with your children, and very often parents don't know what to do with that. They have to come up with creative solutions on how to handle all that, and they're under pressure because everything they learned about their parenthood, the old solutions do not work any longer. And if I can share one more thing, not all parts of our population are exposed to the same level of risk. Women are more exposed to risk, especially women who are healthcare workers. I think that it's almost 80% of women on the front line. Also women working in retail stores, women who are essential workers. And that has consequences to the family too. What happens in the economy, in the labor market, means that a large number of women will lose their jobs. Some of them already have lost their jobs, especially women working as caregivers, household help, babysitters, usually women who are working in informal economy and who are now without their jobs. Yeah, the informal economy issue is pretty complex there, and the working hours of these women are also prolonged without being paid sometimes. Yes, this is additionally raising some dilemmas. I was talking about fathers, but when we look at the crisis, worker families and middle-class families responded differently. Middle class was able to close themselves in their households and work from home. There were challenges in how to harmonize work and parenthood because children were home and you had to organize their schooling, you had to spend time with children and establish some new models of parenthood. However, worker families, blue-collar workers, or families of essential workers and healthcare workers who were there in the front line, they had to go to work. They had to find someone who will take care of their children while they're at home, who will be able to handle the new obligations of children, because that was a new territory for everybody, for the families. And another thing that they were facing was the relationship with the extended family, because often if grandparents do not live with the parents, what happened was that grandparents were isolated and they weren't able to help by babysitting the grandchildren. A survey we did is that in families like this is that the elderly are more isolated without assistance, that their needs are unmet. The percentage of elderly who were in this position, who didn't have anybody to pay the bills or get the groceries, was between 10 and 50% in this particular subgroup of the elderly. So if we talk about the effects, bearing in mind that we're facing a crisis that we don't know anything about, we have no idea how long it will last. So we have to consider different aspects of different populations that are facing this crisis and come up with specific tailored responses, or at least advice on how to respond. And we have to help with this predictability of measures that families have to adapt to in order to establish their routine. Thank you very much. So to conclude, let's have all the panelists come up with their final conclusions and messages. Of course, if you're watching us on social networks, feel free to share your comments or ask our questions. We'll finish the way we started. Madam the Minister is with us. So we heard that we need better collaboration between civil sector and the state. We heard that we need clearer messages on Facebook. Here we can also see that the issue of trust in institutions and all the moves that were made is something that has to be improved. So what is your message in the end?
My message would be that predictability that Professor Stanevich talked about and human resources are actually the two targets that we need to aim at, primarily the government, but also together with the NGOs, the academia, the media, all the individuals that can contribute. We need to take steps and anticipate the gravest possible circumstances right now in order to be able to cope with them. Thank you for participation. Mr. Mossotti, what is your opinion? I can't hear Mr. Mossotti. I can't hear the sound.
Very much, Branko, and it has been quite a stimulating discussion on how we think we should be able to move forward, and I thank all the other panelists as well. But really, the lessons that we've probably learned, and really grateful that it's World Population Day tomorrow, but the lessons that we've learned is that we have to care for each other. I think that we have to identify those within our societies and within our ranks who need that help the most. We must be our sisters or our brothers' keeper, and we must be able to share the information. Information is necessary, and we should be able to also collect reliable data that will be able to inform what it is that we want to do. We have to educate men, especially when it comes to violence, especially domestic violence or gender-based violence. We have to involve men. We have to be with them so that they also understand that these are not good just for them, but also for the entire society. We have to work with the institutions that we have and ensure their accountability, that the institutions are able to deal with some of the challenges that we continually face. We have to address issues of stigma and discrimination, because sometimes older persons are discriminated against because of their age. We saw, especially during the pandemic, because they were thought to be the vectors of the virus sometimes, or stigma for women who have faced domestic violence. And we need to be able to reach out to them. We need to be able to be with them, even if there's social distancing. We have to do our part in making sure that we engage. So I'm very excited about some of the work that we do in Branco with the government of Serbia and also with UNDP and indeed civil society organizations, especially on addressing issues pertaining to low fertility, issues of diaspora, issues of aging, and issues of migration. So we hope that there will be solutions that will be able to work together so that we can make Serbian society a much better society for all to live in it. Thank you.
Hvala gospodine Mosoti.
Thank you, Mr. Mossotti. Mrs. Francine Pickup, from the point of view of UNDP in Serbia, what would be your final conclusion?
And UNFPA for this discussion. It's been really fascinating for me. I think for me, the main conclusion is that, this with COVID, people and institutions have gone through massive change and to some extent have adjusted to this new situation. And I talked about increased solidarity, I talked about opportunities around harnessing technology, and I talked about the importance of protecting the environment as part of that, as part of those opportunities that we've seen during COVID. I think that the point that others have made that for me is most important is that we need to invest in human and social capital as much as in the physical assets and resources to confront this crisis. So for example, the point that the minister made about establishing some kind of ministry for human resources that really builds on and invests in that human capital and those skills in Serbia is a really good idea and something to consider. Also, I mean, the point that Dragan made about fatherhood is really critical. We know that how fathers behave in the home does determine women's decision whether to have children or not. And now in this time, we see, that there are a lot more challenges that families face. And so that will also affect people's decisions about whether to have children. So this is a really important thing to think about now during COVID. And then, as Elena was saying about the risks around domestic violence, I mean, we've seen during this crisis that women's organizations have played a really critical role in providing support to women when they're under lockdown. And so we need to do whatever we can to support women's organizations to be that bridge for women and to help them get the support that they need. So these kinds of social issues are as important during COVID and for the future as the more physical issues. And then my last message is, let's not just take a short-term approach. Let's really think now about, how money is spent, what policies are made, not just for now and addressing this health crisis, but so that we can build a better future, a better society, better environment.
Hvala vam najlepše, gospođo Pickup.
Thank you very much, Mrs. Pickup. Let's lean on what you've just said, Mrs. Jelena Hrnjak from NGO Athena. Key things for the next 10 years in this decade that we've just started in order to leave a better world for our children. What are they? That would sum up our entire conversation in a different distribution of power, in investing in education and alternative and all sorts of education, and improving literacy and non-relativization of the most important issues in the society. We also need to pledge, and we have done so, to cooperate. The COVID pandemic is a special crisis for the entire society, and in addition to disinfecting hands and the area around us, we need to disinfect our thoughts and try to think differently and be in the shoes of other people sometimes. We need to think and care about ourselves, of course, but we need to think about the others as well. I keep repeating to myself the one sentence: don't be indifferent because you'll never recover from it. If you're indifferent, you can't see or help another human being. And if you can't help another human being, then it's a matter of how much you're worth and how much you are functional in a society. So the message is clear, the message of care for another person, for oneself, social care that we need in order to bridge all the problems that we are faced with. Also, let me add, I don't want to sound pessimistic. I'm not pessimistic by nature, but I believe the problem will only start after we have overcome the pandemic, and that we need to work now in a more unified way to invest more efforts in everyone getting, not perhaps equally, but as much as they need. Thank you for participating in this discussion. Mr. Stanojevic has the opportunity to conclude this video discussion. Are you an optimist or a pessimist? What would be your final conclusions? Pessimism and optimism are personal issues. So in that sense, I'm an optimist, and I hope that as a society, as individuals and groups, we will all learn from this and come out of it more clever and as better people. And to conclude, the topic of this panel was a crisis. And I believe that we shouldn't look at it, we need to, as a development opportunity, because the history teaches us that big changes occurred after big crises. But what the history teaches us, what we need to have in mind, is what the price is of the crisis. So the price of what we have discussed today, we need to think about, and we need to work on it during the crisis to minimize this price, especially for the most vulnerable groups. And what will come out as a positive effect, we need to encourage it as much as possible, like parental practices, distribution of parental duties, healthy circulation of population, migrations within the global and European context. Thank you very much, ladies and gentlemen. This concludes our today's panel discussion on behalf of the UNFPA in Belgrade and Serbia on the occasion of the World Population Day. I'd like to thank you for participation and everyone that took their time and who reacted on the UNFPA Facebook page. The whole discussion will be uploaded to the UNFPA YouTube page in English. Once again, stay safe. Preserve your health and the health of the people you love in order for us to get out of this crisis wiser and more ready to face the challenges that are ahead of us in the next decade. Thank you very much.
Thank you so much. Thank you. Thank you very much.
Hvala. Prijetno svima.
Thank you and good day to you, everyone.